we'll get started. All right. Before we begin our talk on cardiovascular health, I just want to mention that we have some wonderful upcoming events. We have health screenings and we have wellness classes and also programs that we would love for you to be a part of. So our next health screening is going to be at Gorgas on March 8th. We have a couple of wellness classes coming up. Don't stress about stress, which if you're on this call, I'm going to highly recommend that you attend this class on stress or go back and watch one of the archived classes that we have on stress or overcoming overwhelm, because all of that really goes hand in hand. We also have some great programs for y'all to participate in. Our Crimson Couch to 5K training program, which our kickoff starts tomorrow, and we will be over at the Student Center. We would love for you to join us. There are a couple of different options, so you can join the actual Crimson Couch to 5K training program for your program credit, or you can do that in addition to really just signing up for the race. So you can do one or you can do both. So if you don't want to do the program for program credit, you can actually just sign up to participate in the 5K, and we would love for you to do that. So there's lots of great information on our website, and we'd be happy to answer questions if you'll have those. So come out and see us tomorrow. We'll be there from 11 until 1, and we'll be in the promenade entrance in the newer part of the Student Center. We also have Better Bites Nutrition Program, which is a fabulous program all about intuitive eating and mindful eating. And then World of Flavors. So that's going to be a Move Spring Challenge that begins March 21st. So a lot of great things to look forward to this spring. So today's class is on cardiovascular health, and I am so excited about this because it's one of my favorite classes to teach. I talk a lot about health and wellness and stress and coping and mental health management. So to get to talk to you about cardiovascular health today is a real treat. My name is Abby Horton, and I teach at the Capstone College of Nursing here at UA. I'm a registered nurse. I am a health and life coach. I have a certification in both health and life coaching. I'm a wellbeing ambassador for the Honors College, where I teach part-time, and I'm your wellness class educator. So excited to be with y'all to talk about heart health. And my email is here, abby.horton@ua.edu. So if you have any questions or need to reach out, please feel free to do that. I'd be happy to answer any questions or offer any help that I can. So today we're going to talk about risk factors for developing cardiac conditions. We're going to talk about the relationship between cholesterol and hypertension, which is really, really important. We're going to talk about risk factors for developing high cholesterol and hypertension. And we're going to talk about healthy ways to actually be able to reduce our high cholesterol and hopefully reduce our high blood pressure. So heart health is really important to me professionally, but also personally. So we have a really kind of complicated medical history with cardiovascular disease in my family, and it's something that's really near and dear to my heart. So to get to make this be super relatable for y'all is just a joy. So if y'all have questions or topics that y'all want me to cover, please feel free to put those in the chat or in the question and answer box, which has an anonymous feature. That's a great tool to use if you don't want to ask your question in public. But I would love to be able to address the specific things that y'all were excited about learning today. So definitely use that if y'all have questions or even comments or feedback. So cardiovascular disease is the global #1 killer. It's something that when you think about cardiovascular disease, it's not just about heart, but it's also about your blood vessels. So we're going to be talking about heart disease and stroke. We're also going to talk about diabetes. We're even going to talk about some mental health and some mental cognition issues that you can have when you have these types of disorders. So there are 18.6 million deaths that occur from cardiovascular disease, or CVD, and that's 33% of all global deaths. So it's important for us to think about how we can start to mitigate our risk. And it talks about 75% or more of those are going to be in low to middle income countries. But I would say that it's really on the rise here in the US, particularly among women. So for February, it's Heart Health Awareness for Women. And so we're going to talk about Go Red for women, although all of the information I'm sharing today is going to be for both men and for women. So just know that that is part of our focus. And with the risk factors that you can have, for cardiovascular disease, you can have things that are more due to lifestyle, and you can have things that are actually related to other conditions you may have, or it could be genetic related, concerns or predispositions. And so there are going to be some risk factors that you can control more than others. And I think that's really important to note as well. So we talk a lot about cancer and respiratory diseases and HIV and other diseases, but CVD is actually the one that's going to be the most likely to cause issues for you when you look at it statistically. So definitely keep that in mind. Heart disease and stroke cause the death of 1 in 3 women each year. And that's through the American Heart Association statistics that they keep. And so they have a Go Red for Women campaign, like I mentioned. And that really equates to 1 woman dying every minute throughout the year. And so that's an important thing to consider just for context. With cardiovascular disease, like I mentioned, it's not just about your heart health, but it's also about your blood vessels. And so that can impact any part of your body and organ system. And so there are a lot of risk factors that you can think of, but we're going to talk about more of the conditions. So high blood pressure, high cholesterol, tobacco use, and diabetes. We're also going to talk about metabolic syndrome. If this gets too technical or too medical, please let me know in the chat and I'll break it down for you a little bit more. So I'm going to talk about a lot of medical terms, more so than I usually do in my presentations, but I want you to get a really good understanding of what some of these conditions and names and things mean. So if you're like me, you may not know that Go Red is actually an acronym. And so it actually stands for Get Your Numbers, Own Your Lifestyle, Realize Your Risk, Educate Others, and Don't Be Silent. And so get your numbers. We always say in health and wellness, you need to know your numbers. And that means you need to know what your blood pressure typically runs. You need to know what your blood sugar typically runs throughout the day. You need to be able to know what your weight and your BMI are. You need to kind of understand those types of numbers. And so you can keep track if there are changes. And, it's important to have a range so that in the morning, my blood sugar may be this. In the afternoon, my blood sugar may shift to this range. Your blood pressure may be slightly elevated when you go to your doctor's office or your healthcare provider's office. And so it may be different when you're at home or in other situations because our blood pressure will fluctuate throughout the day. So knowing your numbers is important, but it's not just that you know your numbers at one point during the year at like an annual exam, but that you have a good idea of what those run throughout the year. So we're going to be doing some blood pressure checks tomorrow. So even if you don't sign up for the Crimson Couch to 5K kickoff event, you can still stop by and we're going to be at the event taking blood pressures. So you can come see me and my nursing students tomorrow, and we'll be happy to talk to y'all more about this. Owning your lifestyle is really understanding what your risk factors are from a lifestyle perspective, realizing what those risk factors are so that you can start to make changes, because awareness is really the first step in being able to make healthy changes. Educating others is so important, not just so that they understand what you may be facing if you are at risk for cardiovascular disease, but so that you can actually maybe help them, because with 1 in 3 women being impacted, and certainly that's comparable to what the rate is for men, then you are probably looking at a room full of people who have a lot of risk factors for these conditions that they may develop later in life. And then don't be silent. It's really about spreading awareness. And so I hope that this is helpful for y'all. There's actually a declaration for empowering women, because we often think about heart disease and strokes and heart attacks as being something that's really related to more of a male risk factor, but we know that that's not true. Women actually are more likely to die from heart attacks than for men. And part of that is not that there's a genetic or gender relationship there. It's just because women's symptoms present differently. We think about the stereotypical, left arm pain, and we think about the elephant on the chest is what people will usually describe as the pain. And women typically don't have that type of pain. They typically have a lot of GI or stomach issues. They tend to have more shoulder pain that radiates to the back. And so they may not have the stereotypical traditional symptoms of a heart attack or even of a stroke. And so they may miss the signs that they need to get some medical help. So that's why we're focusing a little bit more on women with this presentation. So hope that's inspirational and informative for y'all. I want to talk about cholesterol. And this is one of my favorite things to talk about because I think the relationship between cholesterol and high blood pressure is really a mystery to a lot of people. And even within the healthcare setting, we don't talk about this nearly enough. So with cholesterol, we talk about cholesterol as if we shouldn't have cholesterol, as if cholesterol is really bad for us. And if you've ever come to my presentations, you know I talk about how we moralize things in our culture. We talk about things as being good or bad or good or evil. And really, most things are neutral and necessary, and cholesterol is necessary. We don't want cholesterol to be zero because cholesterol actually has a function in our body. And we talk about blood pressure as being the silent killer. It even is right here on this infographic as the silent killer. But what I personally would tell you is that cholesterol is the silent killer because you will actually have symptoms of high blood pressure once you start to get advanced high blood pressure. But high cholesterol often does not have any symptoms at all. Even when you are in a high range of high cholesterol, you still may not have any symptoms there. And so I would say that high cholesterol is actually the silent killer. So what happens is, and we'll talk more about this throughout the presentation, is you go and you get a blood pressure check. And usually the provider will say, your blood pressure is high. That's interesting. How long have you been having high blood pressure? And they'll ask you, have you been having headaches? Have you been fatigued? Have you been tired? And usually yes is the answer to those questions. And then they'll go and look at your blood work and they say, oh, well, that's interesting. Your cholesterol is also high. Well, let's look at that. And they sometimes never make the connection for you as the patient that the reason that your blood pressure is high likely is because your cholesterol is high. Those things are usually positively correlated, but we sometimes as clinicians do not make that connection for folks. And so I hope that that helps you as we go through this presentation to understand that relationship. So what happens with high cholesterol is that you get this little yellow line right here. That's representing the cholesterol. And this tubule is representing the blood vessel. And so what happens is when you get high cholesterol that can't be processed in the body, and I'm going to walk you through what that looks like, then the cholesterol starts to deposit or attach to the sides of the vessels. So your blood vessels start to get these deposits of cholesterol. Well, eventually they can get to the point where the cholesterol builds up so much that it narrows the blood flow. Think about it as being a water hose. It narrows that blood flow. So you have to have more force or more pressure to be able to get through that narrow opening. Just like if you let your water hose outside corrode and it's got all that corrosion and iron, you get that, kind of buildup of pressure. You've got to turn on the water pressure more to be able to get water to go out through that narrow opening. Well, that's what happens with our blood vessels. The blood pressure is that water pressure in the water hose. It has to pump that harder. So that valve that we turn on at the spigot, that's our heart having to pump and work harder to get more pressure to get through that narrowed opening. So that's the relationship between cholesterol and blood pressure. And so oftentimes, you can have high blood pressure without having high cholesterol, that's for sure. So don't misunderstand that. But a lot of times the reason the blood pressure is high and it stays high is because the cholesterol is high. So this is an infographic that's going to be really helpful to you. And Miranda is on the call, and I bet she's going to pop that presentation for you in the chat so you can save it if you want to come back to these slides, because there's a lot of information here. I just really want y'all to understand that relationship. And if y'all have questions, definitely let me know. So cholesterol isn't bad, it's necessary. And cholesterol, as you see depicted here, you see the LDL, where it's made to look like a little devil with a pitchfork. and then the HDL that's made to look like an angel. Because remember, we moralize everything, right? It's good or it's bad, it's good or it's evil. And then we've got the red blood cell, okay? So what happens is with the LDL, the way that we were taught in nursing school to learn about this is that LDL is the lousy or the bad, kind of cholesterol particle and or lipoprotein, and the HDL is going to be the healthy or the good cholesterol. And so the thing about it is that makes it sound like you don't want any LDL, and you have to have that to be able to work and to function properly. So what you want to know is that cholesterol is mainly comprised of fat and lipoproteins. And so lipoprotein is the makeup of cholesterol, protein, and fat or triglycerides. And we're going to go through each one of those, even though it sounds like we know what those are. And I'm sure you probably do. We're going to talk about their functions individually. So cholesterol is actually available to us in our bodies naturally, but we also can consume cholesterol. So we make cholesterol in our bodies, but we also eat cholesterol in the form of food that we intake. And so what we really want to think about is optimizing our production of cholesterol, but then we also want to really look at our consumption of cholesterol, how much we're actually eating. So every cell in our body requires that we have cholesterol, and cholesterol is needed for things like hormone synthesis, vitamin D production, which vitamin D is more like a hormone, not a vitamin. So that's a little bit of a misnomer. And then we have to have it for other body functions. So normal body functions require cholesterol at the cellular level. And I'm going to go to the chat because I see some things there. Good. Okay, awesome. All right. So what is cholesterol and where is it created? So cholesterol is going to be a soft, fat-like, waxy substance that's found in the bloodstream, and it's in your body's cells. Cholesterol is normal. It's a healthy aspect of the body, and it's a healthy aspect of your health. And your liver actually makes cholesterol, and it is in some foods like meat and dairy products. So if we don't have this, our body is not going to function properly. And having too much cholesterol in our blood raises our risk of coronary artery disease or cardiovascular disease. But what I want to mention to you is that it matters what types of cholesterol you have. And if your cholesterol is too high, you need to know, is it too high because you have too much HDL? Do you have too much LDL? Or do you have too many triglycerides? So we're going to break that down. So if you get a total cholesterol reading from your provider, you need to ask them for the ratios of HDL, LDL, and triglycerides, because you may have a high cholesterol. We usually like it to be less than 200, but you may have it because you have too many HDL, and that would be probably a good thing, actually. So you want to look at the total picture, not just your total cholesterol, which is usually what we get back when we go to get our blood drawn. So this is our liver, and I want you to think about this as Pac-Man. So anyone who was a fan of Pac-Man, you think about how they gobble things up in that little kind of arcade game. Well, that's how our LDL and our HDL act. So the liver has these LDL particles. And remember, we said these were the lousy ones, right? And it carries cholesterol to the cells. And the thing about it is that I don't want us to think about them as being bad or lousy, because what happens is the cholesterol deposits that you see right there, the little yellow pieces, that is actually being sent out to repair damage within the body. So if we have a blood vessel, or we have, some type of event where we have too much inflammation or we have injury, the cholesterol is actually like the Band-Aid that the liver sends out to repair those. So the cholesterol forms that really vital function of Band-Aiding the areas where we need the most help. And so it's not a bad thing at all. What happens though is if we consume too much LDL, and if our liver isn't functioning properly and we get too much LDL, and the ratio of LDL to HDL gets a little bit wonky, then what happens is once it goes and does its repair, so it's coming down here to fix our little artery or our vessel right here, then the extra of that, to be able to process it, you have to have HDL. So the HDL have to be the Pac-Men that come in and gobble up the extra LDL that didn't get used in our repair situation right here. And if we don't have enough HDL or we have too much LDL, then the excess cholesterol can't get removed. And so it gets deposited or left in the vessel, and it can form what we call a plaque. So it's just a lot of cholesterol that's attached to the vessel wall, then it's called a plaque. So what happens then is when the HDL takes all that it can take back to the liver, that cholesterol gets used up, it gets processed, and then the liver creates the cycle over again. But the problem is that we keep getting these plaque deposits, and eventually those plaques will actually rupture. And it's described as rupturing like a zit that you would pop on your face. It just kind of volcanoes out. And what happens then is it can throw a blood clot to your heart, or it can throw a blood clot to your brain, or it can cause a spasm, or it can cause a vessel to collapse. And that's when you start to see those cardiac heart events. You know, you start to see heart attacks or strokes. It's really from that plaque rupturing. And that's just one way that you can have that event occur. There are other obviously things that can happen, but that's the really common one that you'll see. So with triglycerides, they're a type of fat that's stored in the body, and it's the most common type of fat. And triglycerides can be a number of different types of fat. So you can have saturated or unsaturated fats. And we talk about one of those being good and one of those being bad. So triglycerides usually come in the form of butter, oils, and that they're the extra calorie leftovers essentially. So triglycerides get left over when we didn't use those up. So if we aren't burning the amount of calories that we're consuming every day, which is pretty typical, we usually have extra calories left over. That's why we put on extra weight sometimes. Then those triglycerides are getting stored as fat in the body in adipose, what we call adipose tissue. So these are the calories that you eat, but your body doesn't need, and so it stores it, and you need a little bit of a reserve. So our bodies are actually designed to keep us alive. It's not to keep us thin, it's not to keep us happy. Our body's function is to keep us alive, it's to keep us surviving. We have to take extra steps to go from survival to thriving. And so that's important to keep in mind, because then you can kind of appreciate what your body's doing. So your body keeps those extra calories and transfers them into triglycerides and stores them into fat cells. And so then when your body needs that energy, it will release the triglycerides out into the body. And so when you're going to get your blood work, it may look like you have a lot of triglycerides, a high triglyceride level. And maybe because you're going through something that needs extra energy. It also may be because you've got so much triglycerides on board that you can't actually store it. There's not enough fat cells to store that triglyceride. So those are some things to think about as you start to think about your relationship with food and how, all of this relates. We will talk about the levels in just a second. Yes, absolutely. Barbara, those are shared in the chat. If you'll scroll up, Miranda posted those. And I think they're probably the first two things you can see in the chat, but we can also send it via email if you don't get those. Awesome. So with that in mind, we have the normal ranges here. So triglyceride levels, we want to see those be less than 150. And so if you have a triglyceride that's greater than 150, then you can definitely start to have some issues with inflammation, and you can start to have some issues with metabolic syndrome, which we'll talk about, heart disease, and different conditions like that. You're going to be more tired. You're going to be probably storing more abdominal fat, so more fat around your belly. You're going to start to really see blood pressure start to raise. You're going to see cholesterol raising. You're going to see inflammation on the rise. So those are some things to think about. Usually with HDL and LDL, I'll get to that next slide. We're going to give you some optimal ranges, and certainly there's going to be variation within those because we're all bio-individual, and we're just going to give you some textbook numbers to look at. So types of fat, unsaturated fats versus saturated. So your unsaturated fats are going to be your healthy fats. So there's some examples here. Yeah, Greg, we'll talk about, can they be too low? Absolutely, HDL can be too low. So unsaturated fats are going to be things like what we call healthy fats, your salmon, your avocado, your walnuts, your olive oil, your flaxseed. Some would even say peanut butter, and peanut butter is good as long as it's not overly processed. The kind of peanut butter we probably all like is not the best option, but if you can get, really good organic, non-GMO, non-sugar added peanut butter, then that's amazing. If you're not allergic and you're not getting all those extra chemicals and sugars, then peanut butter would be a good healthy fat. So then saturated fats are going to be things like animal fats, and we need animal fat. I know there may be people who for ethical or religious or health needs don't consume animal fat or products. But our bodies tend to do a little bit better in terms of energy when we have some animal fat. Otherwise, you're going to need to really have some complete proteins and eat very strategically in how you eat fats with complete protein to be able to get your body to where it needs to be at the macronutrient level. And that's a little bit outside the scope of this presentation, but that is something to consider when you're thinking about getting good consumption of fats and proteins. But with full fat dairy, you also can have saturated fats. And I am a fan of eating more along the lines of having full fat. I don't really think that low fat is the best way to go. So I think the thing you want to do is to eat full fat in moderation versus, eating low fat without limits, because low fat is going to have more chemicals and more sugars and more additives in there to make the food look and taste good. So I'm always going to vote for full fat, and I'm talking about things like whole milk versus skim milk. You're going to have better outcomes, probably depending on your risk factors. All of this is so individual, like I mentioned, but most people are going to do better with full fat in moderation. But saturated fats do trigger the liver to make excess cholesterol. And so you want to make sure that you're aware of that. And talk to your nutritionist or to your healthcare provider about what's best for you. And conventional medicine is going to tell you to do low fat, and that's okay, but just know that fat is needed. Trans fat can be naturally occurring or it can be artificial. So we have things like food preservatives in fried, baked, and processed foods. So if it comes from, a facility, a plant that a manufacturing plant comes from a human source, it's probably going to have trans fat. It's probably going to have preservatives. It's probably going to have chemicals and food additives and things like that to preserve the shelf life. And so if it doesn't come from an actual plant or an actual animal, it's probably going to have that trans fat. You can have some naturally occurring trans fats, and that's important to look at when you're doing your food labels, because again, trans fats that naturally occur, that's just a part of life with butters and oils and things. But you can make healthier choices. And again, I'm going to tell you, I would rather eat butter than margarine, because butter is going to be healthier for you, and you can eat that in moderation versus margarine, which does have a lot of additives and chemicals and things. So again, that's my stance. I'm not a nutritionist, but in the research that I've done, I think that is a better outcome for most people. And with the trans fats, it actually will trigger your liver to make excess cholesterol too. And it does it in a way that's even really more impactful and can be more harmful than the saturated fats, because our body has a difficult time with trans fat being processed, because it goes through this hydrogenation process that makes it just a little bit more difficult for your body to be able to manage those. So if you're eating really high carb, high saturated fats, high trans fats, then you're going to have a difficult time, because your liver can only do so much with what we're giving it. And so that's important to note too. So with this red, yellow, and green light, can the triglycerides be too low? Yes, triglycerides can be too low. We don't talk about that because most people in America are not going to have low triglycerides. But yes, you want to have good storage, because, if you are going to be like an ultra marathon runner, or, you're an athlete, or even if you just have a busy life, or have something going on, maybe you're sick for a prolonged period, your body is going to need to be able to pull energy from your triglycerides. So you do need to have a storage of triglycerides, just because that's a safety survival mechanism that we've not overcome yet from our prehistoric days. So with the red, yellow, and green light, that is really, something to think about. So it would be the reverse. It would be unsaturated fats are going to be our green, saturated fats are going to be our yellow, and trans fats are going to be our red. So we want to really try to eat more unsaturated fats, eat minimal saturated fats, and then try to avoid trans fats. You really want that to be 0 if you can, especially if it's on a processed food item. So cholesterol, again, is something that we have to have, and you know that it circulates in your body and your bloodstream. And adults really are recommended that you be screened every 1 to 5 years, but most people are going to screen you every year for an annual exam once you start to get into your 30s. And so when you look at, cholesterol types and things like that, the reason I included this is because it gives you this breakdown ratio of total cholesterol. So your total cholesterol is your LDL cholesterol plus your HDL cholesterol plus your triglyceride number divided by 5. And so when you get your total cholesterol, when you go to a health screening or when you go to your healthcare provider and you're getting your total cholesterol, it's not giving you the full picture of your health if it's not also listing out what your LDL, HDL, and triglycerides are, because it's not giving you the full picture. And I have had patients who have had a higher total cholesterol simply because they had a higher HDL, which was actually a healthy, aspect of their health. It was actually a really good thing. And so that's important to know. All right, so the downside of too much cholesterol. So when we have too much, like I mentioned, then it can really start to impact the lining of those arteries or those vessels, and it can start to form those plaques. And so when it does that, then the artery, like I mentioned, starts to narrow like our water hose, and it becomes less flexible. And so when you talk about having, heart disease, or you talk about having to have stents placed, those stents are going to be those. Usually it's kind of like a plastic graft that goes in the artery that holds that open, and makes that artery be, open, and they'll go in and actually clean out the artery to get rid of those extra, cholesterol deposits and plaques and things. And so that is kind of what that looks like. So when you have hypercholesterol, which is right here, hypercholesterolemia, and then atherosclerosis, you can start to develop high cholesterol, which then becomes this issue with your vessels, and you get atherosclerosis. Then you can develop heart disease, and then that can lead to the heart attack and the stroke. So again, like I mentioned, it's so important to note that there aren't symptoms of high cholesterol. You usually find out that you have high cholesterol after you've had a high blood pressure reading, and that can take a while. So you usually have to have a number of readings that are high before you get diagnosed with hypertension, and we'll talk about that. So the health concerns that you can have then are heart attack, stroke, poor circulation, and then your high blood pressure. So this is what a normal artery is going to look like. This is what the narrowing of the artery is, the atherosclerosis. So then this is an early stage where you're beginning to form a cholesterol plaque. And then this is significant atherosclerosis, or advanced cholesterol plaque. But what I really want to mention here is this is considered a complete blockage in this last image. And so that's considered last stage atherosclerosis. What's so important to note here is that this would be considered 100% blockage, even though you see it's really not 100% blockage. But it's because the impact of this level of blockage is impacting the function of the blood vessel at 100%, even though you can still see there's an opening here. And I think a lot of people don't realize that. And so when you have someone that says, it was an actually complete blockage, there was no blood getting through, then that's where you're seeing that really lasting damage, and even cardiovascular deaths from those events. And so again, this is going to be 100% blockage. And I think that's really very eye-opening for many people. So inflammation then starts to occur when you get high levels of cholesterol. So again, the yellow is the cholesterol here, and these are the red blood cells that are trying to flow over this path. And so what happens is when the LDL begins to kind of seep into the inner wall of what is this vessel or this artery, the blood pressure gets really high and it triggers the inflammatory response. And so then you start to get even more accumulation of cholesterol because the inflammatory response is activated when there's an injury or there's some type of event. And so then it's a cycle of the cholesterol is high, inflammation starts, so cholesterol is high. And it's this vicious cycle that gets really difficult for you to manage because you've got to get relief from the cholesterol or you've got to get relief from the inflammation to be able to stop the cycle. And that's why so many people will end up on a cholesterol lowering medication like a statin because they can't really understand how to stop the cycle. And that's what we want to talk about today. So inflammation continues to go on, and eventually you'll have, high cholesterol, but you'll have high inflammation, things like high SID rates, high C-reactive proteins, and you'll start to have inflammation all over the body, and you'll start to get really puffy, and you'll start to have signs and symptoms of high inflammation as well. So warning signs that you're having some issues with clogged arteries, again, the highest level, you're going to start to have heart attack and stroke events, but you can have fatigue and dizziness, shortness of breath. So that could be shortness of breath because you're exerting yourself, or it could be shortness of breath just by sitting here and listening to the talk. You can start to have chest pain, even low back pain, which I think is really surprising. For men, you can start to have symptoms of erectile dysfunction because of the blood flow issues that you're having. And you can also have like painful, numb, cold hands or feet because the blood circulation is not getting to where it needs to go. So as we're talking about high blood pressures, we made the connection earlier, but let's kind of shift gears into that. So the pressure that your blood exerts against your arteries is pumped through your body by the heart, and that's the blood pressure, kind of going back to that water hose. So the valve at the spigot is your heart, and it's pumping that blood or that water out into the vessels or out into that, water hose to get where it needs to go. And so the pressure in the arteries will increase when the heart beats and decreases while it's resting. And that's going to be where you start to see the blood pressure. And that's why you have the top number and the bottom number. One is at rest and one is at work. And so you're really going to want to look at those numbers. We usually say 120/80 is a blood pressure that we want to see. And we're starting to say now that we actually want it to be less than 120/80, but not too far below that, because you need a good blood pressure to have energy. But we're wanting to see that it stays lower than that range, because once you get to 120/80, if you have any kind of event, a stressful email, a stressful call, an accident or injury or a sickness, then your blood pressure is going to be in the pre-hypertension stages if you're already at a resting blood pressure, a healthy blood pressure of 120/80, sorry. So that is going to be something that you want to consider. So with the blood pressure, you can see this is the normal opening for your vessel. So this is your normal opening, your normal pressure. As it starts to narrow, you see that you start to have pre-hypertension. And then as you get to even more of that narrowing, closer to the complete blockages, although that's not always the case, sometimes you can still just have high blood pressure from other things. It's not always induced by cholesterol, can just be stress hormones like high cortisol. Then you can start to have more of a complete blockage. So this is explaining the systolic and the diastolic blood pressures, that top and bottom number that I was mentioning. And so this is another example of what this would look like with increased pressure on the walls, where you start to see those cholesterol deposits, and then where you have the actual plaque buildup. So just a lot of different ways to look at those. So monitoring your blood pressure is really important. Something that you want to do when you're, thinking about your heart health and thinking about a health and wellness journey, that's a good number to know. And you want to know it, like I said, not just when you're at the doctor's office. So when you're going to your grocery store to pick up groceries, or you're going to the pharmacy to, to pop in and make a purchase, see if they have a blood pressure machine. Take a reading and note whether you're stressed or whether you're rushed, or, whether you're relaxed and not in a hurry, because that will impact your blood pressure for sure. We have a couple of different blood pressure machines on campus now. One is at the Student Center. I believe it's on the first floor. And there's one over in the HR office that you can actually look at over on the Flint Road. And so there are a couple of different options on campus where you can monitor your blood pressure with those machines. And of course, you can always get a reading or a check with your provider, but it's good to just spot check it. And this is going to be the normal range, the green range. So less than 120, less than 80. And then elevated, it's not going to be something that is a huge increase. It's just 9 or 10 points. And so 120 over 129, you're already in the elevated. And so that's why we've changed the parameters for what we want normal to be. And then less than 80, like I said. So it goes up into these ranges. And if you get into the hypertensive crisis stage, you're at the 180 or higher than 120. And the bottom number is actually usually more concerning. So when usually people are more concerned about the higher number. So 120 is always this number should always be higher than this number here. But most providers are going to be more concerned when you start to see a high number here, because that's when your heart should really be at rest. And so if you're getting close to 100, and we want it to be more like 70 or 80, then it means that your heart is having to work really hard to be at rest. Okay, so that's something to consider. And obviously, all of this is just for educational purposes. You want to make sure that you're working with a healthcare provider if you have any of these concerns or risk factors or things. So I mentioned that they have high blood pressure. I'm going to tell you, I have high blood pressure. Like I mentioned, I have cardiovascular disease in my family. My mom had a heart attack early onset at 54, 55 years old, which is considered early for a woman and early for anyone really. And I have a heart condition. I have mitral valve prolapse. And so I do have to be really careful, and I do all of the quote unquote right things, and I still have high blood pressure. So I'm working on getting my levels down. So I don't want anyone to ever think that I'm speaking to you from a place of having this perfectly, aligned in my own life. It's just, unfortunately, sometimes you can do everything quote unquote right and you still have challenges. So I never had high blood pressure readings prior to COVID, but randomly blood pressure will run high these days. Yeah, and I think there's a lot of reasons for that. I think we're just in a really stressful environment. I think the uncertainty and the unknowns of blood, of what's going on in the pandemic and just our world in general is hard. That's going to create stress. That's going to cause hormonal fluctuations that increase your blood pressure, which definitely are different. And then I think having had COVID also can impact that, but we just don't know enough about that at this point. Shouldn't blood pressure guidelines be age dependent instead of one size fits all? Yes, and we're doing a one size fits all approach just because we don't know the ages of all the participants on the call. But that's certainly one reason why you want to work with a healthcare provider, because they're going to take into consideration your age, your gender, gender based on hormones only. And that's the only reason why that matters. And look at your other risk factors. And so that is definitely why it's so important to have that consultation with a provider and get that more personalized, individualized feedback. Absolutely. And things will change. Once you get to your 30s, that's usually when you start to see an increase in blood pressure. So there are some age-related things, but also some lifestyle things that just happen by age. So it's not like automatically at 35, a switch gets flipped and it's like, okay, now it's time for her to have high blood pressure. But it's just kind of a natural progression, because that's when you start to get more responsibilities at work. Your body starts to age. There's just a lot of things there. This is just another graphic about your blood pressure. I try to give y'all lots of different things that y'all can really grab onto, because we all learn in a little bit of a different way. But hypertension is going to be something where you have sustained high blood pressure. So what I tell my nursing students all the time, and what I want them to teach our patients, is that when you have high blood pressure, that does not equal hypertension. So we use those terms interchangeably, and it's not the same thing. So high blood pressure, any of us on this call can have high blood pressure. If we all got an upsetting email, we probably all would have a spike in our blood pressure. But it's those people who have, sustained high blood pressure over periods of time, diagnostically, usually 3 or more high blood pressure readings, is going to get you the diagnosis of hypertension. And so I actually have the diagnosis of hypertension. You can have things like headaches, shortness of breath, nosebleeds, flushing, dizziness, chest pain. You can have irregular heartbeat, pounding in the chest, visual changes, blood in your urine once it gets advanced, fatigue and confusion. And fatigue can really be an initial symptom too, but confusion, of course, would be a later stage symptom. So when we say it's the silent killer, you can see there are a ton of symptoms we just may be attributing to other things, like probably stress, right? But with cholesterol, it truly is a silent killer because there aren't these outward symptoms that you see. So like I said, blood pressure fluctuates, every day, all day long. So it's going to be different in the morning versus the afternoon. It's going to be different if you're, more sedentary one day and more active another. So blood pressures are something that you want to just have an idea of how yours run. If you start to feel dizzy, lightheaded, headache, fatigue, and you just don't feel well and it's not blood sugar related, definitely consider having your blood pressure checked. And like I mentioned, this is the diagnostic criteria for hypertension. Some things that we've mentioned about high blood pressure, obviously, most of these we've mentioned, but kidney disease and kidney failure is something that can result as well, and that's going to be later stages, along with the others that we've mentioned previously. And the impact of hypertension is that about 1 in 3 adults have hypertension, and a lot of people don't know that they are pre-hypertension. So about half of those people, 54% with high blood pressure, only about half of them have their condition well controlled with medication. And so even with medication, it can be difficult to keep your blood pressure under control because it fluctuates so much, and it's designed to. So risk factors, things like stress and smoking and substance use. So that could be tobacco use, that could be illicit drug use, obesity, diabetes, salt intake, an overly processed diet, even caffeine consumption, other lifestyle factors like your sleep and just your activity and your overall wellness. Those are all risk factors for cardiovascular disease. But things like family history, genetics, ethnicity, so not race, but ethnicity, age, and sex, all of those things, like so sex in terms of gender, those are the things in red that you don't really have control over, but it's important to note those things because, again, you're going to see some differences depending on these factors. So treatment is usually, from a conventional medicine standpoint, going to be medication. It's going to be diuretics and ACE inhibitors and beta blockers and calcium channel blockers. And that's great when you need them. That's certainly something that you work with your doctor. I was on a diuretic for 3 years while I was working on lifestyle changes to be able to get my blood pressure under control. And then I was able to switch to a new medication to be able to make the transition to come off of the blood pressure medication. And it was a 3-year journey for me, and it's still an ongoing journey because if I stop doing the healthy things I'm going to show y'all and teach y'all about, then you're going to have that regression. And so it definitely is a commitment to try to do this without medication. But I got to the hypertensive stroke level blood pressures, and I had to actually have medication immediately. I got a pill at the office and I left with a prescription that day. So I just want to give y'all hope and encouragement that you can make lifestyle changes, but it's not going to be something that's a quick fix. Diabetes definitely has a connection to this because you're going to, when you have high cholesterol, you're going to have that inflammatory response and you're going to see your glucose or your blood sugar go up to try to help with the inflammation and with the repair that is going on in your vessels and your arteries. And so the combination of having diabetes and high cholesterol really can compound your risk factors for heart attack and stroke, peripheral artery disease. And so that's going to be the arteries having issues in your legs, having that narrowing or plaque buildup in your legs, high blood pressure, kidney disease, diabetic retinopathy, cataracts, and glaucoma, which is going to be that high pressure. And so if you have that, then you're at risk for having metabolic syndrome. So that can be things like high blood pressure, high blood sugar, low HDL, high LDL, high triglycerides, and usually excess fat around the waist. And the more excess fat or adipose tissue that you have around your waist and in your core is going to put you more at risk than having excess weight in your arms or legs or face, because it's putting extra layers of adipose tissue or fat tissue around your vital organs. And then that's making it more difficult for your organs to work. It's making your liver harder to work. It's making it harder for your heart to work. So many things. So if you have all of these things, high blood sugar, high blood pressure, low HDL, high LDL, high triglycerides, and excess fat around your waist, then you have metabolic syndrome. And I have a condition called PCOS that's highly related to this. People who have polycystic ovarian syndrome often have metabolic syndrome, and there's things that we still don't understand how those things relate and kind of interrelate to each other. So, at one point in my journey, I would have been diagnosed with metabolic syndrome. And so I think that's important to think about your hormones too, that there can be other conditions related to this. We just don't have time to go there right now for this presentation. So when you think about what can you do, you can stop the things that you know are going to contribute. So discontinue smoking, don't use tobacco products or nicotine. Try to make sure that you're doing everything you can to support your health. And smoking, vaping, tobacco use, illicit drug use, too much excess alcohol use, those are things that you can start to really work on. When you have smoking, vaping, tobacco use, that is going to really slow your wound healing because it reduces your oxygenated blood in your body. And that's why you're not healing at the rate that you would if you weren't using those products. And that's something that people often don't know. And so when you're deprived of that oxygen, you're going to start having poor health results. And part of that is your cardiovascular health. So start there. And then a more holistic approach to health is going to be really controlling what you can control. I like to put this in my mental health talks, but I think it's so important for you to remember that there's only so much that you can control. There are things outside of our control related to our health and our genetics and certain things, like I mentioned, certain risk factors, we can't control those. So really focus on what you can control and don't let this be something that causes excess stress, because we have more control than we think we do. These are 7 steps to a healthier start. So again, starting with a healthy diet, getting active, controlling your blood sugar, even knowing what your blood sugar is running, watching your cholesterol, maintaining a healthy weight, monitoring your blood pressure, and then going, tobacco, vape, smoke-free is really great. I will say about your blood sugar, if you're spot checking it, if you still feel like you're having some issues with high blood sugar or low blood sugar, we act as if those are 2 different conditions, either you're low or you're high. But the truth is that people who are hypoglycemic probably are having high blood sugars, and people who have high blood sugar, who are diabetic, certainly will dip down and have episodes of hypoglycemia. So treat that as a range. We used to talk about that as they were totally separate conditions. You're either high or low. We know now that there's a range, a spectrum of where you are on that line of high blood sugar or low blood sugar. So if you feel like you're checking your blood sugars and the readings are good, but you still feel like you're having issues with that, you definitely want to ask your healthcare provider to check your complete CBC for your blood work and look at your blood sugars, look at your hormone levels, specifically your testosterone and your estrogen, whether you're male or female, we have both, and look at your HbA1c. That will look at the total amount of blood sugar in your blood over the last 90 days. And if you're having high testosterone as a woman, and if you're having high insulin levels and a high HbA1c, it may be that you're just producing a lot of insulin to gobble up that extra blood sugar. So your blood sugar reading looks good, but you're actually still having issues. So that's something that people don't know to check, but that's something you can ask your provider about. These are some wellness basics. I always tell people to start here, because if you're not sleeping well, if you're not staying hydrated, if you're not eating a healthy plate, you're not eating a lot of vegetables and protein and healthy fats, if you're not eating a variety of foods and colors to get those good minerals and antioxidants, if you're not moving your body every day, even if that's not formal exercise, and if you're not giving your body and your brain a break with meditation or rest breaks or things like that, then the other things we've talked about are going to be more difficult for you to do. If you're not doing these 5 things, it's going to be difficult for you to give up, caffeine, or it's going to be difficult for you to reduce some of your alcohol intake. It's going to be difficult for you to reduce your smoking and vaping and things like that. So start here, regardless of what your goals are. Maybe you just joined this call and you didn't have a personal connection to cardiovascular health. You still want to start here if you're looking at doing some health and wellness. So these are some things, again, y'all got the presentation, you can download it from the chat, but just tips on how to get better sleep, how to make sure that you stay hydrated, how to make sure that you're nourishing your body. And this is, we're kind of in the toolkit part of the presentation, some things to do to move your body. So this is not a fancy gym membership. This is not a CrossFit or Orange Theory workout where you're really stressing your body. That actually can be really counterintuitive for people who have high cholesterol, high blood sugar, and other things like that. It can make that worse because your body's having to work really hard. So start with walking just for a few minutes. Start with 5 or 10 minutes and work your way up to 30 minutes a day. Simple little things can help a whole lot. Meditation, just give your brain a break, 5 to 10 to 15 minutes, 2 to 3 times a day. So in the morning, afternoon, and evening time will be a huge, stress reliever for you, and will start to help you make other positive changes. And just be mindful of distractions. I always tell people to try to be present in the moment, be present where your feet are, try to laugh and have fun. Joy is good for the heart. Joy is really helpful when you're trying to heal. Make sure that you know that your mindset matters. This is a GLAD technique for mindfulness. So writing down something that you're grateful for, something you've learned, something you've accomplished, and one thing that, delighted you or brought you joy. This is a great way to have a mindful, kind of gratitude practice and start to think about mindset. Some practical tips when you're making changes: make them sustainable, make them simple, make them, something that you can do. A friend of mine, Katie Moore, says if you can't do it for 3 years, don't do it for 3 minutes, and just do one thing at a time. So exercise, these are going to be more geared toward cardiovascular health. So moderate to vigorous exercise 3 to 5 times a week for 30 to 45 minutes is usually what we say. And you can work up to high intensity interval training, which is going to be good for your cardiovascular health. We forget that cardio exercise is cardiovascular for good heart health. Know your body mass index, but just use that as a guideline. This is not the golden rule anymore. We just want you to have it as a baseline reference. And again, here's some more information on that. The DASH diet can be really good for hypertension, but just know the fat-free and low-fat can have extra chemicals and additives like I mentioned. So use those things with caution. And then look at the nutrition labels. This is where you see the trans fat. You also now have had updated food labels that have the saturated and unsaturated fat. So try to get trans fats to be 0. A lot of times we only look at the calories, but really start to look at your fat, your cholesterol, and your sodium and your carbohydrates. Even things like your sugars and dietary fibers. It's so important to look at the food label beyond just your calorie count. And this is a good way for you to be able to understand your food label. So I hope that will be a good resource for y'all. These are some things that you can try: turmeric, omega-3s, fiber, more plant-based options, and healthy fats are going to really help with your cholesterol and high blood pressure. Try limiting these things that I've mentioned before. And this can really help jumpstart your health and wellness journey when it comes to cardiovascular health. Of course, reducing stress is important because we can do all of those other things. And if we still are stressed, we're going to have some poor health effects with our heart and cardiovascular health. So these are ways that stress affects our body in particular. We have a lot of talks on stress management. So we would love for you to go to our wellness.ua.edu page, and there are archived talks on how to overcome overwhelm, how to do healthy habits, stress and coping, just so many great resources there. We'd love for you to follow us on our other social media. So I know that we're at our time, and so you're free to go if you need to go to your next call or go on with about your day. But I'm going to stay and answer any questions that y'all might have, and you're welcome to pop those in the chat. Thank y'all so much for those of you who attended today, and just really want to applaud you for carving out an hour of your day to join us and to learn more about good heart health. Okay, we had a question in the box from Yvonne about getting the handout. Yes, Miranda, will you pop it back in the chat? I know sometimes if you join late, if it's posted before you come in, it won't actually show it to those participants. Thanks, Yvonne. Oh, thank you. That's really sweet of you to say that it's a good presentation. Thank you. Thank you, Miranda. We couldn't do this without Miranda. All right, I'm going to try to make sure I don't miss anybody's. Heartbeat can be impacted for a number of reasons. And the ranges for the HDL, you really want those to be above 60. So we had a question about that range. So HDL above 60, and then total cholesterol usually lower than 200. And if you're still on the call and ask me about that, if you have more questions, I'll be happy to answer that. Good, I'm so glad that you learned something helpful. Yes, the presentation slides, Miranda just copied those in so y'all can download them from the chat. But if you didn't get them, reach out to me or Miranda and we'll be happy to do that. Yes, please feel free to share this with your friends and family. This will become a YouTube video. And so once it's on the archive wellness.ua.edu webinar page, you can go here and it will be a recording that you can send out. It'll be a YouTube video and you feel free to share it with whomever you like. We want people to get the good information, but certainly, you know, this is just for, you know, educational purposes. Definitely work with your provider if you have specific concerns. Let's see if we have any other questions. With the question about BPM higher than 100, send me an email and we'll talk more offline about that one. That's a more specific question. Yes, feel free to reach out. My email is right here. I'll be happy to reach out to you about that one. All right. I don't think I missed any other questions or comments, but I certainly appreciate you taking time to be here and to participate. And if there was anything that we didn't cover that you would have liked to have seen, or anything that you need more clarification about, any of that, please feel free to reach out to me and I'll be happy to provide those resources or to address it in future presentations. But thanks so much. Just remember, take it one step at a time. Do one thing at a time. This is just something that could be really overwhelming, and you know, drinking more water, getting better sleep, that's a great way to start. And taking a couple of walks a day or a couple of walks a week, just start where you are, use what you have and do what you can, and be really proud of yourself for showing up and trying to make healthy changes. Thank y'all so much. I hope y'all have a great rest of your week.